Yeah, good afternoon, Anas. Thank you so much. And I'm really happy to welcome you all once again to our another session on HIV and public health. And in today's session, we will start with the third block of our course that talks about the HIV/AIDS prevention and care. So just excuse me a bit because I'm having a little cold, so my voice may sound a little rougher than usual, but I think we can make it. Okay. Uh, so till now, if anybody can tell me what all have we studied, just a quick revision of whatever we have studied till now. Anybody? Yes, Chipiliro. Anna, Scandiro, anybody who can just let me know?
Hello, ma. What do you say? Come again.
I said, can we have a quick revision of what we have studied till now in the
Okay.
three sessions that we did in the past few days? What all have we covered? Can we just have a quick revision? Anybody can just quickly go through the topics that we have covered till now? Yes,
Yes,
Candida?
yes, ma'am. On
Yes, Candida.
block 2, unit 1, we talk about transmission of HIV through sex,
Okay,
and we discuss a lot on it. Model of transmission through sexual activities,
okay,
factors responsible for causing infections,
okay,
and so on. HIV transmission risks for different practice, and so on in Unit 1. And
okay,
in Unit 2, we talk about let me we talk about blood of transmission of blood through transmission of HIV through blood,
through blood, right?
which we discuss on transmission on vulnerable populations.
Okay,
And we discuss on issues related to transmission of HIV through blood,
okay, right.
and so on. That's what I will add on what you asked. Thank
Okay.
you.
Okay, Anas, thank you so much for your feedback. Candiro, you want to say something? You want to add on to it?
Yeah, the past lessons we have learned about HIV/AIDS and
Okay,
how it was started and when it was started and the way how to get rid of it, and also you give us assignment just to find out how the government in our country
yeah,
set some programs to combat HIV/AIDS. And another thing we have learned about the mother to child, how children, young kids can affected from this HIV/AIDS, and
okay.
how to prevent it or to control, to get rid of it. Yeah, I think that's it. It's what I can remember now.
Oh, yes, yes, Candiro, thank you so much. Thank you for adding on to it. So till now, we have been able to finish at least two blocks actually of our course. And in the first block, we studied the concept of public health. What is meant by public health? What are the major components of public health? We also studied about the various theories related to diseases and how the history of public health has changed over a period of time. What is the present situation? What is the current context in terms of the health for all, in terms of the Millennium Development Goals, and so on and so forth? Okay. We also studied about the emergence of HIV/AIDS, history of transmission of HIV/AIDS. What are the plausible theories which are related to the emergence of HIV virus in humans? We have also studied about the various modes of transmission of HIV/AIDS. First, with The sexual transmission, second is through transmission through blood and blood products, and the third was the transmission from mother to the child. Okay, so these were the three modes of transmissions that we have studied for HIV/AIDS. Apart from that, another thing is use of intravenous drugs and infected needles that can also cause AIDS in healthy people. Then apart from this, we also studied about what are the various issues related to testing. What are the tests, like namely the ELISA test and the Western blot test, that is there world over, that is practiced to find out about the status of an individual, and issues related to testing, concept of counselings, the pre-test counseling and the post-test counseling. So all these things we did in the last two units, in the first and the second units. Now, today we are going to start with the third unit, which talks about HIV prevention and care of patients suffering from HIV/AIDS. Now, in this block, we will be studying about ways to prevent HIV/AIDS, how we can control, and what are the governments doing to control HIV/AIDS. We will also talk about the various care that can be given to such patients, like where can they get care, who is giving them, who is responsible for looking after patients suffering from HIV/AIDS, and also some of the social influences that impact the transmission of HIV/AIDS. We will also look in some of the ethical issues which are themselves related to HIV/AIDS, and finally the life skills in the context of adolescent health. Like what are the life skills that we need to impart to adolescents so that they are able
Your microphone is on.
a healthy lifestyle. Okay, so these are all the things that we are going to cover in this particular block. So the first unit in this talks about ways to prevent and control HIV/AIDS. So we will learn why is there a need to control or prevent HIV/AIDS in the first place. How can we prevent the various modes of transmission, like prevention of sexual mode of transmission or through blood or from mother to child? How we can do that, and what are the other universal or some of the precautions that have been suggested world over, or standardized precautions for HIV prevention. So all these things we will be looking into this. Now, we know that there is a saying that prevention is always better than cure, right? If you can prevent the onset of a disease, it is much, much better than actually curing it in the first place. Isn't it true? Who wants to get infected, or who wants to get, sick? The first thing that always comes into the mind of an individual is how can we prevent this situation in our body, or the onset of this disease or infection into our body? How can we do this now? Today it has become all the more relevant, and as well as easier, since we already know the modes of transmission of this disease. Okay, now we know that how this disease is transmitted from one person to another, right? We know how an infected person can pass on the HIV virus to a healthy person. So that means that once you know the mode of infection, it becomes easier to prevent the spread of this HIV in the first place. Doesn't it become easier?
It become easier, ma'am.
I said that once you know how a particular infection or a disease is transmitted from an infected person to a healthy person, we can definitely find ways to prevent the spread of that infection. Doesn't it? True or not?
It's true, ma.
It
It's
is
true,
true, of
Mama.
course. Once you know how a particular disease is caused, what are the factors that lead to the onset of that disease in our body, or how it is transmitted from one person to another, then it becomes easier for us to prevent that in the first place. Now, this is the same thing that is happening in the case of HIV. Now, if you remember when the corona had spread across the world, the governments, they were very straightforward in saying that okay, people need to wear masks, they need to isolate themselves, they need to stay inside the house as long as possible, as much as possible, prevent any public places, prevent crowds. They were also told to sanitize their hands or wash their hands every now and then in order to spread this infection, right? So, this is exactly how things have started in the case of HIV/AIDS. Now, we have already discussed that after the first case was discovered in 1981 in United States, several cases they started coming up in other parts of the world, and sooner by the late 80s and 90s, AIDS had started spreading as a kind of a calamity. It has taken the shape of a calamity because of certain unhealthy behaviors or lifestyles that was shown by individuals. Okay. Now, we also know that there is no known cure for HIV/AIDS yet. So, once a person is infected, the person has to live with that condition, and also it can also lead to, it also usually it leads to untimely death because of the secondary infections or the uh, you can say that the other infections that take inside the body, that happen inside the body because of the weak immune system. Okay, they are known as opportunistic infections. So once a patient gets infected by these opportunistic infections, it becomes difficult to treat them because of the failing immune system. Okay, so till now, till date, we have no vaccine which can ultimately prevent us from getting infected. Like even for corona, we were able to come up with a vaccine, but for certain diseases, including HIV/AIDS, there is still no vaccine available in the world that can prevent us from getting infected. Okay, and a lot of studies have been carried out with respect to HIV/AIDS. Doctors and researchers around the world, they have tried to find out, but till date they have not been able to they have not been successful in finding a cure or even a vaccination that can prevent the spread of HIV/AIDS. Now, HIV/AIDS has been in existence for over 3 decades now. Okay. And there is no other microorganism which has undergone such an extensive research as the HIV virus. Okay. But still, we have not been able to achieve any breakthrough. So, till now, there are only certain solutions which are available for the prevention and control of this disease. And the first is spreading proper awareness or educating the masses about the likely mode of transmission of HIV viruses and what behavioral changes or lifestyle changes they can bring in order to prevent the onset of this disease. Okay. Uh, now, there is definitely uh, there is a need that this kind of an awareness program, it should reach everyone across the globe. Okay, like every individual across the globe belonging to every country, and there is a need to consciously develop a well designed HIV/AIDS education program starting from children. Like we know across the world, the age for sexual activity, that has declined to quite some an extent. So nowadays we see that children as young as 15 and 16 years old, they are also getting into this kind of a activities. They are also getting into sexual activities because of the you can say that the way the social media and everything, every information is now available to them. So even the young children, they are getting into sexual activities very soon, in very younger age. So there is definitely a need to start talking about these things, right from the school time, because in several countries across the globe, we say that the traditional approach, that has stopped us from talking very openly with children. So till date, we find that most of the traditional societies, they do not talk openly about sex or sexual activities with the children. So all these information relating to the sexual activities, relating to the reproductive health of especially of girls and women, these are things that need to be very openly spoken about. Okay, and this is the only tool that is available with us to control this pandemic, because till the time citizens are not made aware of the mode of transmission, till the time they are not made aware of what all behaviors they need to change, there is no way we can control this epidemic. Okay, and needless to say that everyone has a right to information, and proper education about HIV/AIDS can go a long way in helping people to protect themselves and others from infection by HIV. So, till date, education is the only medicine which is available in the world to contain the HIV epidemic. Okay, all preventive education programs, they should offer much more than just information. Okay, it should also include exploration of values and aimed at development and practice of skills. Okay, now we will talk about this later when we discuss the section on the life skills. Now the first step in this regard is to overcome denial. What do you mean by denial? What do you understand by denial?
Hello, ma.
Yes, Anas.
Someone to argue on what he do means he denial on what he's doing. That's what I
Yes,
understand.
yes, right. Denial is basically not accepting the truth. Many a times we find that generally neither the individuals accept that they are suffering from HIV/AIDS, nor the families they are ready to accept. Even the administration, even the governments, they deny the fact that the problem of HIV is so much prevalent in their part of the world. Okay, they just do not accept that this has become such an extensive problem. Okay, and even in India, this was there was definitely an attempt in the beginning to hide this the extent of the problem. Okay, because even India is a very traditional country, and all these the kind of what we can say stigma that is attached to a person who is who is actually diagnosed with HIV, that is very, very huge. So, definitely, the denial is something which is very easy. So, the patients, they don't accept that they have HIV. The families do not accept that they have HIV. And even the individuals, they just don't accept the fact that they are at high risk of contracting HIV. Okay, so this is the first step that is important, that we need to come out of this habit of denying the truth, or denying the fact that the AIDS has spread as an epidemic. Now, what we require, what is the need of the hour today? The need of the hour is to contain the further spread of HIV AIDS. We also need to take care that those who are affected with HIV infection, they are rehabilitated. Okay, such survivors of HIV, they are properly taken care of. They are given proper medical facilities. They are accepted by the society, and any kind of discrimination should be, you can say that it should definitely be avoided at all cost. Now, in this, the keeping in view, the most important part in the preventive measures would be to keep to discuss some of the preventive measures in view of the routes of HIV transmission and the potential target group. So here, in this part of the presentation, we will be talking about uh, what we can preventive measures we can take in order to prevent the roots of HIV transmission. Okay. Now, first is, as we all know, prevention of sexual transmission. Now, there are several sections of the population we have already seen which are highly vulnerable to HIV transmission. Can anybody tell me who are these sections? Who are the vulnerable groups?
Hello, ma.
Yes.
Like same-sex activities, like
Okay.
sex workers,
Okay.
like people who are in behaving of homosexuals. I think
Yes.
they are part. This is what I'll ask.
Definitely. Definitely. See, there are a lot of vulnerable populations which are very at a high risk of spread of HIV transmission. And first of all, as Anna said, that of course you have the homosexuals or the individuals who are into same-sex activities. Now, uh, basically, if we say that homosexuals are said to be individuals who are involved with having sexual activities with individuals of the same sex, okay, and regardless of their sexual identity or sexual orientation, and irrespective of whether they also have sex with women. Most of the time we will find that the situation the traditional most of the traditional societies, they are such that irrespective of their sexual orientation, okay, we find that more often than not these individuals are made to forcibly marry a individual belonging to the opposite sex. So you may see that there might be a man who is so sexually oriented towards another man, or a woman who's sexually oriented to have a relationship with another woman. But irrespective of their orientation, because of societal values and societal pressures and family pressures, most of the other times, most often they are made to marry or live with individuals of the opposite sex. Okay. And in such, this is where the problem arises, because you know what happens, this leads to transmissions in a large number of population, because of the fact that these individuals are getting into multiple partners. Okay, so they get involved with multiple partners, and that is where the problem arises. Okay. Now, the second part is specifically we are talking about what are known the population who are known as the third gender, or the eunuchs as we call them. Generally, most often than not, they are into lot many multiple partner activities, as well as with the, you can say, commercial sex work. And this is again one population who are very much uh, susceptible to contracting HIV AIDS, because of again multiple partners and unsafe sex. This can also be said even in case of women, because usually women are more often than not involved into prostitution, different types of prostitution. Okay, most of the times they do not have any say in the kind of sexual activities, the frequency of sexual activities, whether or not they want to use a condom. Even they do not have any control over their own body when they want to have children, whether they want to have a child or not. So in all these decisions, in all these aspects, women generally stay in the receiving side of the thing. So definitely they become a very highly susceptible group as far as the um, this is concerned. Now, another susceptible group is, you can say, that the adolescent who get into sexual activities, okay, at an early age. So, as I said earlier, that nowadays the normal age for getting into sexual activities has come down to as less as 15. Even in several traditional countries, it is the same thing. More often than not, adolescents are getting into premarital sex, or even before they come of age. So this creates lot of problems, not only in terms of teenage pregnancies, but also spread of HIV/AIDS, because usually they are the one who are least educated about the occurrence of this disease. There are some other groups also, for example, prisoners. We say that in prisons, generally, there is a very high prevalence of HIV infection, obviously, okay, because there is a great deal of homosexuality which is seen. And another thing is the use of maybe even drugs. So there are a lot of the prisoners, and most of the times they also get into all these high risk behaviors, and prisons are one place where this is found to be at a high rate, the transmission of HIV. Apart from this, of course, we have other persons, like people in the defense forces, and even the truck drivers, or the transportation workers. They are also in the high risk group, because they are generally staying out of their families for a long period of time. And a lot of them, at times, they show high risk behaviors, like having relationships with multiple partners, or even showing homosexual activities. So we find that these are some other groups or populations where this prevalence of HIV/AIDS is very high. And in the absence of a HIV vaccine, the safest and the surest way to avoid any new HIV infection is through behavior changes. Okay. Now, modification, it aims to reduce the high risk behavior of individuals, which make them and others getting infected with HIV. Now, the behavior intervention, it includes using things like condoms, awareness generation among groups, among individuals, among families, among communities, stigma reduction, how we can reduce the stigma which is related to HIV/AIDS, okay, and patients suffering from HIV/AIDS, access to services including the medical services, educational services, all these things. Then decrease in sharing of contaminated injection equipments, and limiting the number of sexual partners. So once we are able to educate individuals on not using intravenous drugs or other contaminated injections, and limiting the use of sexual partners, then we say that all these behavior modification can go to a great extent in preventing the transmission of HIV/AIDS to other healthy population. Now, in this case, now an important aspect is the use of condoms. Now, do you think, one question which I want to ask you, do you think that condoms are effective in stopping the transmission of HIV/AIDS? What is your take on this?
What do you say, ma? Network. I have network issues. What do you say, ma?
I was asking Anas if What do you think that condoms are effective in stopping the transmission of condoms? Sorry, in the stopping the transmission of AIDS.
Yes, 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 ma. Sometimes it is.
Okay, who all support Anas? How many of you say yes, Michael? Yes, Michael.
Yes,
O-
yeah, it
Okay,
can assist you to control, to prevent the HIV, but it depends on how you have used it. If you use it um,
okay,
controllably or nicely, definitely it can control, but not really 100%. It can control to another level of
okay,
percent, not 100% full. Thank you,
okay.
ma'am.
Yes, yes, Chipiliro, you want to add?
Yeah, it can be one of the way of prevention of HIV and AIDS, but it cannot be 100% depending on the way it has been used. If you follow the instruction, it's fine. It can prevent. Thank you.
Okay, okay. Yes, condoms are effective in, besides from the fact that they are very useful in family planning. They are very much effective, but we cannot say that there can be 100% surety. Why? We all know that at times condoms they have found to burst inside the vagina. Okay, many a times we see that usually the condoms they burst inside, especially if it is not of a good quality. Okay, and if it is not worn properly by the partners, and so there is a high chance that the HIV can transmit in case in such cases. But still, condoms they do continue to be used as an important method, not only for family planning but also to control the spread of HIV AIDS. So the governments world over, they are definitely making efforts to to provide more and more availability of condoms, like that is known as a social marketing of condoms. Social marketing means that you are um, encouraging the use of a certain product when that product has some good social use. Like in this case we know that not only condoms serve the purpose of family planning but also in avoiding the spread of HIV/AIDS. So, in the AIDS awareness campaigns and in the programs which are run by the government, we will see that most of the times the governments are providing free or condoms, or even condoms at a very subsidized rate to the individuals, so that they can use it during the sexual activities. So this is one important measure that has been taken by the government everywhere across the globe, and this has also been promoted by United Nations, UN AIDS, and they have all supported the use of condoms. Now there are again there is a male condom as well as a female condom, and even nowadays the female condom is getting more and more um, what you can say popularity, because of the fact that at times it is difficult for the females to make their male partners use condom. Many times the male partners they do not use condoms for a lot many reasons. So at times women are not able to make them use condoms during sexual intercourse. So nowadays, there is also availability of a female condom, which can be used by females, which protect them from unwanted pregnancy as well as from the transmission of HIV/AIDS. Now, after this, we talk about how the prevention of transmission through blood and blood products can be done. Now, when we were discussing the spread of HIV/AIDS through blood transfusion, we have also discussed this to some extent, how this can be done. We have seen that the transmission of HIV is possible from one person to another through the use of unsterilized needles and syringes and other such skin piercing instruments like surgical instruments. Okay, so any kind of instruments which can be pierced through skin, okay, or any kind of other such invasive procedure, they can definitely transmit HIV from an infected person to a healthy person. In procedures involving surgical instruments they should be properly sterilized. So we have already seen that there is a very extensive protocol for the medical community, for the health workers, for doctors, for paramedical staff, and for other individuals, institutions who are involved into healthcare provision, that they need to sterilize these instruments, okay, and if it is possible, even go for disposable instruments. Like we have seen that nowadays, instead of using those glass needles, we go for these disposable syringes and needles. Okay, these can be used, they are single use needles which can be easily thrown away. Okay, and they are very safe, and this they also ensure that any kind of infection, it does not take place uh, from one individual to another individual, because it's not only just HIV/AIDS. These unsterilized needles can cause a lot of other infections and septicemia in patients if they are not sterilized properly. So that can lead to a lot of problems to patients, and that is why nowadays they have started using instruments which can be used one time and then discarded subsequently. Now, that is why individuals, they always have to be careful in getting an injection from a hospital or a health clinic. So always try to carry a fresh disposable needle. Usually the hospitals are supposed to do that. In just case if you find that the hospitals are not do that, you need to make them do it, or carry an injection yourself, carry a disposable needle yourself, and ask them to use that needle to administer the drug or the medicine. And this is the best way to avoid any kind of an infection. And it is definitely it's everybody's right to ask for such measures to be taken by the doctors or the nurse, okay, before they use any kind of an invasive um, procedure. And even when we visit a dentist, we need to make ensure that the dentist takes adequate precautions when they are providing dental care and treatment to their clients. And this is something that we can always say to the dentist. Make sure that the dentist is using such surgical equipments and some other things which are actually properly sterilized. Even visiting places like, say, visiting to a barber for a shave, we need to carry a fresh blade always, or ask the barber to use a fresh blade when we are getting our ears or a nose pierced, or even getting tattoos. This is something that we need to ensure that fresh and sterilized instruments are used. Okay, so this is one thing that can be definitely taken care of. Another thing is, in case of organ transplantation, proper checkup of the person who is donating, or who is donating the blood or any of the product, that should be done. And we have already seen that any kind of trans blood donation from a professional blood donor should be avoided. And in many cases, in fact, nowadays they have come up with certain guidelines where they have prohibited the use of professional blood donors. And in the in the banks, in the blood banks, they have been provided with some very extensive list of the do's and the don'ts or the protocols that they need to follow. And I said that I have told you that, like in India, for example, the highest court, the apex court, that is known as the Supreme Court, they have issued guidelines that every blood bank needs to be properly registered, and there has to be a proper investigation carried out. They need to be properly regulated, and proper care should be taken on how you keep those blood and the products, the specimens, and conditions like proper refrigeration, and taking testing the blood before you actually take, and asking for a person to donate blood in lieu of a blood. So this helps to not only to maintain the quantity of blood, but also it helps to lessen the rate of infection to a great extent. So this is something that needs to be done. Another important fact apart from this is how we can prevent the injecting drug users from doing it. Now, see, there are a lot of people who are suffering from this problem of drug abuse, and a very extensive counseling and therapies it needs to be given to such persons, because anyways addiction to drug is definitely not healthy even in the long term. Not only this may lead to HIV in case of intravenous drug use, but overall it is very, very, very harmful for our overall physical as well as a mental and psychological well-being. So any kind of drug addiction, if a person is suffering from any kind of drug addiction, then he or she needs to be properly counseled. They need to undergo proper de-addiction therapies, and also the government is definitely doing a lot to do that. For example, they have started uh, coming up with such de-addiction centers, and also providing facilities and counseling services to such patients in all the hospitals, and also working out ways in which they can be rehabilitated once they have overcome the drug problem. Now, injecting drug users must be specifically targeted as far as the HIV is concerned, and because not only they pass it to uninfected person, they also indulge in sexual activities. Through these sexual activities, they can again pass it on to their partners or other persons. Okay, so these activities, so this need to stop, and we need to try and educate them, try and educate individuals about the about the harms of using these injecting drugs, and also uh, try to overall prevent the unhealthy practices for the well-being of each and every individual. Okay, now anybody who has come across any such individual who has been using injecting drugs?
Hello, ma.
No.
Once I see a girl that is being injected through her veins, through hand, but at times the place did not take injection. She started taking the injection from her head. I
Okay.
asked her what is the reason of doing this. She said that if she did not do it, she is not getting comfortable. I said it's very bad too. She said that this is what she chose for herself. I should leave her. Thank you.
Okay. Now there are a lot of efforts, that have been that are underway to reduce HIV transmission in case of drug users. This includes implementing educational programs that explain the risk which is inherently involved in using contaminated equipments. Secondly, also replacing the used syringes. So we not see, it is not possible to actually get a person of the drugs in one counseling. That person is invariably going to go for drug use. But what we can do is we can definitely ask the person to replace the used syringes, okay, and use the a new syringe for that. Providing antiseptics to treat needles before their use, okay, that is one thing that can be done. Legalize syringe sales, okay, that is also important, because until unless syringes are not legally available, it becomes very difficult to check the prevention, to check the spread of HIV. Then also providing primary drug treatment, to wean the individual from any kind of drug use or from this habit. So these are certain things that has been provided by the government. And not only in India but in other countries also. I'm sure your country is also very much working, the government is very much working along this line. And we also involve the family as well as the spouse or the partner of the drug abuse. And this is how we kind of try to um, uh, uh, prevent the spread of HIV/AIDS through the blood and other blood products, as well as through the use of infected needles. Now, the third is to study the prevention of transmission from the mother to the child. Okay. Now, we have seen yesterday that this is something which happens, that the unborn child is definitely in a at a high risk of getting the infection from the mother. So that infection can pass before the birth of the child, while the child is still there in the womb, through the placenta, because it is the placenta through which the child uh, gets the nutrition and other things from the mother. And sometimes the blood from the mother, the infected virus, the virus may sometimes pass through the placenta and enter the child's body. The second is during the process of delivery. We see that usually the vagina contains a large number of HIV viruses. So in this case, sometimes during the course of normal delivery, when the child is being delivered through the normal blood, whenever there is a vaginal delivery, then there are high risk for the child to get the infection from the mother. And this can be generally avoided by going for a C-section or a cesarean section. Okay. So in the cesarean section, generally there is a incision is made in the uterus, and the child is easily taken out, and the child doesn't have to go through the birth canal altogether. So the child is generally, you can say that, safe from contracting the virus. The third is, of course, by breastfeeding, through breastfeeding. Now, we have already said that one must always go for available information on the risk associated with breastfeeding and HIV transmission. And we have also seen that almost about 14% of children, they get infected through breastfeeding. So it should be a thought out and a joint decision by the parents whether they want to go for breastfeeding or for artificial feeding that can replace the breastfeeding for the child. So now these are some of the issues which are definitely given to this. Now, drug intervention nowadays can prevent mother to child transmission. Okay, now like in the year 1994, researchers in United States, they did a study on the mother to child transmission of HIV, and found that a particular antiretroviral drug, when it is given to HIV positive women orally, they generally, there are quite a reduced risk of the child uh, getting uh, infected with HIV virus. So generally nowadays this has been accepted by the governments worldwide, and they try. to whenever the a woman is found to be HIV positive and is pregnant, then they generally start giving her antiretroviral therapy so that the infection does not pass on to the baby. Okay, and generally there is a great deal of efforts made by the government to provide this medicine to the mothers in time and at you can say subsidized prices, so that um, um, every person, every individual, whether he or she belongs to um, um, a rich family, or those who are belonging to even to the below the poverty line, they can easily afford this drug. So there are some other preventive measures also which are including, like for example, at times HIV positive women who want to conceive a baby, need to they must seek counseling as well as a medical opinion, okay, of the doctors. Even the positive pregnant women, they generally are not asked to opt for an abortion, and they must seek the medical opinion if they want to go for such a thing. Although usually it is generally after a careful case by case study, it's the medical practitioners who give their opinion. Now, the positive HIV positive women, they are always suggested to go for a cesarean section, which we have already discussed, and this prevent the infection passing to the child during the childbirth. And as far as possible, uh, an HIV positive mother also should not breastfeed the baby, because again we have seen that there have been studies which suggest the transmission of HIV through the breast milk. Now, again, there is a very kind of, there is definitely a need to be cautious when we are reading literature on HIV prevention, which are imported from other countries. So, definitely, we need to see what suits best in our particular situation, in our particular context, the kind of practices that we have, the kind of traditional and cultural practices that we have in our particular in our part of the society. All these things have to be taken into consideration before we go for any kind of a reading about the literature on HIV prevention. So all these things have to be taken into consideration. Now, there are certain universal or standard precautions that can be taken as far as HIV prevention is concerned. Till now, we have studied the three direct methods through which there is a high possibility of getting infected by the virus. Okay. Universal precaution consists of a set of guidelines which are created to prevent the spread of disease transmitted through the body fluids for the protection of caregivers and anyone with such diseases. Okay. Now, these precautions, although they were created primarily for medical professionals working in a hospital settings, whenever they are likely to come into contact with blood or other blood fluids. Now, in US, the Center for Disease Control, that is a CDC, it is a very famous organization which gives various guidelines and other such, you know, help in terms of. Yes, Ahmed, you want to ask something? Are you there, Ahmed?
Yes, madam. Hello.
Yes, Ahmed. You wanted to ask something?
Yeah, I want to just ask some questions regarding HIV/AIDS. My question is that a person with HIV/AIDS, can she
Okay.
or he heal from that disease or not? Because I heard somebody says that the doctors now discover the HIV/AIDS medicine. Is it true or not?
Ahmed, I was not able to hear you clearly. What exactly? Can you just repeat the question?
Okay, I write it in the chat box. Maybe my network is not clearly.
Yeah, yeah. You please just write it down. I will see the question and I will let you know.
Yes, I write it down.
Yeah, yeah, yes, yes, yes. So the Center for Disease Control, which is an organization in USA, they introduced certain universal precautions to emphasize that precaution must be taken when exposed to any blood or a body fluid, because any patient could be infected. Okay, we cannot know who is infected, who is not infected till and until that person goes through a test. So there were certain, universal precautions that they suggested, and these universal precautions, they are now known as standard precautions. And the name, there has been a change in the nomenclature, because these precautions, they have to be applied in all situations, and they have become the accepted standard of care. Now there are certain practices that are used as part of the universal precautions. Firstly, every patient must be treated as potentially infected. Got it? What do you mean by this? Every patient should be treated as potentially infected. What is meant by this? Can anybody tell me? What do you mean by this statement that every person should be treated as potentially infected? Okay. This means that, yes, Francis, you want to say?
Yes, I want to say that is one of the universal precautionary measures to say, since we don't know that which one is infected until it's tested, we
Uh-huh.
must assume that every fluids, every blood could be infectious. So that when we are handling clients, we must handle with extra caution, knowing that we may be infected by such, since we don't know the status of anyone.
Okay. Yes, good. So it means that we need to consider every patient as a potentially infected patient, that he may or may be suffering from HIV/AIDS. Because what happens by the time the patient is diagnosed with HIV, almost 50% of the investigations or the blood work is over. So we need to treat every patient as potentially infected person, and especially the persons who are investigating the blood, they need to be very, very, very careful when they are handling the blood products. Okay, they need to constantly wash their hands with soap and water. Okay, between each patient contact, also use gloves. Okay, whenever they are handling blood products, and if there is accidentally, if they touch blood or some other bodily fluids, they need to thoroughly wash the hands. Okay, then the gloves that they use, they need to be disposable if the body fluids are contacted, and double gloves during the surgical procedures. So whenever there is some surgical procedure that is being taking place in that patient, then the the medical practitioners, they should wear double gloves. Okay, and especially those who are having any kind of a skin lesions or any kind of a cut or bruises, they should not perform procedures if they are exposed to body fluids. Okay, so this is something that the medical practitioners need to understand. And wearing of gowns, that is mandatory when clothes may be exposed to body fluids. So whenever there is a chance that the clothes may be exposed to body fluids, the medical practitioners must always wear gowns. Okay, wearing of masks and eyewear, this may also protect them from any kind of a splash of the body fluids. through the into the nose or the mouth or the eye. So all this thing can definitely protect them from any kind of infection, and that is why mask and eye wear, they must be worn. Sharp instruments, they should be disposed of, okay, in puncture resistant containers immediately after they are used. Needles specifically, they must be disposed of immediately after use without recapping. So you are not supposed to recap those needles. They must be immediately destroyed or disposed of after use. And disposal containers should be placed in all areas where sharp objects are used. So all these are certain, precautions that are must be practiced very, very diligently and sincerely by the medical practitioners. And in fact, nowadays we see that generally there is a very in most of the countries there is a very strict adherence to, disposal of biological hazardous waste. Okay, so whenever these things, they are considered to be biohazard, like they can actually lead to all kind of problems if they come in contact with individuals. So that is why they are treated as biohazards, and their disposal, okay, that is done in a specific manner. So that is how basically your HIV disposable HIV infection can be prevented to a great extent. Okay, now there are certain prevention practices that the healthcare system has been made mandatory in the healthcare system. Although till now there has not been too many cases of healthcare workers actually contracting the diseases, but on and off you find that there may be some cases where the transmission to the healthcare workers because of percutaneous exposure that happened. Okay, now, what happened that there has been some recommendations that the healthcare workers need to follow. For example, the healthcare workers who perform invasive procedures should know their HIV status. So again, when we were discussing about the concept of testing, HIV testing, we also said that every individual, that there are certain individuals that need to undergo HIV testing on regular intervals, and it needs to be mandatory. So so healthcare workers who are performing any invasive procedures like surgery or other things, they should know their HIV status. Okay, and they should avoid performing invasive procedures that involve significant exposure to body fluid. So if an HIV infected healthcare worker, he or she must avoid performing invasive procedure. Okay, so who are already infected with HIV, they must not perform these invasive procedures, and they must seek an opinion from an expert panel on which invasive procedures will be conducted of his or her infection. So what kind of procedure can he or she do, what other things that he or she should not do or restrain away from. Then they must also be approved for conducting invasive medical procedures. Okay, they must be approved. They must get an approval from the concerned authorities. Mandatory testing of healthcare workers is generally not warranted because of the low risk of transmission. But usually, in certain cases, uh, it may be done. The testing of the healthcare workers may be done. Uh, a pregnant healthcare worker is generally advised to limit her interaction with an HIV infected persons, just to make sure that there is no risk of HIV infection to herself or her child. Okay, so these are certain things that are generally made made mandatory for healthcare workers, for workers who are either HIV positive themselves or a pregnant healthcare worker who is working with HIV patients. Now, now there are a lot many other things of how prevention of infection can take place in case of an accident in a hospital. Of if a healthcare worker gets actually accidentally injured, then they can protect against the dangers of acquiring the infection. Okay, like most of the injuries, it generally occur due to needle stick injuries. Sometimes, they may not know that there is a needle, and they you may know just accidentally stick the needles into the skin. Now, these can be prevented if they are careful and follow the procedures diligently, the procedures that are given, okay, for the healthcare workers. In if they get a needle stick injury and bleeding from the wound, it should be encouraged. The wound should be washed with water and with an antiseptic. Okay, so any kind of an antiseptic can be used, and the initial blood that whatever blood is oozing out, that should be allowed to ooze out in order to make sure that the infected blood, if the infection has transmitted, the wound, it should be the blood should be taken out of the body, and the wound should be washed with water and an antiseptic. Now, the injury, it has to be assessed by the medical personnel. If it is not known, the patient should be checked for the infection after obtaining his or her consent. And if the patient refuses consent, the test can be done without the consent of the patient. This would depend from, again, from country to country, and of course from case to case basis. There is no universal as such, directives, but generally, this is a practice which is generally used by the medical community. Now, if a healthcare worker gets an injury from an infected patient, then he should get his blood tested immediately. And again, that test should be repeated after an interval of 6 weeks. And if the first test is negative, obviously, and the second test is positive, then the injury can be attributed to cause the infection. So that we will definitely know that that injury has led to the spread of HIV/AIDS in the worker. Now, these are some of the preventive, measures or the precautions that can be taken to spread the HIV/AIDS. After this, we come to the kind of care, the health care that can be given to the patient suffering from HIV/AIDS. Now, the need for care is often not apparent whether to the patient or the health providers immediately after infection with HIV. The reason is generally this disease, it progresses slowly. From asymptomatic HIV infection to AIDS, it takes a longer time. But after some time, we find that generally the patient may get afflicted with quite number of infections and symptoms related to AIDS, and that is why they require care on a daily basis to carry out not only their health, their everyday chores, but also to live a more healthy life, where their life can be prolonged in to some extent. Now, what happens that often for the person and the family, economic problems may be more important than the HIV infection. Okay, this is important to see that needs in terms of people's own definitions and priorities. Now, the essence of a comprehensive care, it provides a very good opportunity to respond to a wide range of needs of the patients. Okay, so for a care to be comprehensive, it must contain a wide range of support services, okay, which can be met by a number of institutions as well as individuals. So, instead, networking with existing services available or capable of being developed within a community is very much essential. Now, they must the such services, such care, they must include referrals between home, community, and the hospital. So these three institutions, or these three places, like the home, the community, and the hospital, they are they play a very important role in taking care of the person with HIV/AIDS. Now, continuum of a care, it must include a dynamic set of support services. So, not just the support of the family, but also the support of the community is required. It must also include clinical management, like how early diagnosis can be made, including testing the blood, treatment, and follow up care. Also, nursing care, promoting and maintaining hygiene around the patient and providing with proper nutrition. Then there are other aspects like palliative care and health education to home based caregivers, including observance of universal precautions. So, in case if a person is being treated at home or is being provided care at home, in that case also they must be sticking to the or observing the universal precautions. Counseling must be done to such individuals from time to time basis, because we know that most of the times stress and anxiety can afflict not only the patient but also the caregiver. So the caregiver may also suffer from lot of stress and anxiety, and also they might require some kind of psychological and spiritual support. So obviously this must be provided in order to provide a good quality of life and reducing the risk to prevent new infections. Okay. Now there are various institutions which can be a part of the comprehensive care or continuum care of the patients. For example, there can be daycare centers, there can be home care, and there can be hospital care, and finally a hospice care. Now there's a difference between a hospital and a hospice. Does anybody know what a hospice means? Has anybody heard the term hospice? No one? Nobody knows what a hospice is? Okay. Now, hospice are actually institutions which are generally run by various societies. They could even be run by various religious, by the religious, you can say, bodies. So they run hospice. They provide hospice care where the patients who are suffering from any kind of a terminal illnesses, or where they are in they require some terminal care, some psychosocial support, they can be kept there, and they provide them with all these uh, uh, you know nursing services. They provide them with proper nutrition, and basically a lot of spiritual and other psychosocial support is provided to the patients in such cases. Now there are places which we call as the daycare, where the patients are generally referred to, and they provide very simple treatment to the patients. Like they may provide them with counseling services, they may provide them with testing services, they may also give some kind of preventive education to the patients as well as to their caregivers. They may also provide clinical examinations and provide a early diagnosis of opportunistic infections which the patient may be having or developing. So these are some of the things that the daycare will provide to the patient. Apart from this, there is also what is known as the home care, which is being provided to the HIV infected person. Now, these are actually used for training purposes, like this is basically training the family members to provide the care to the patients. So this is generally the here the caregivers or the family members, they are trained to identify the common symptoms that are related to AIDS. They are also responsible for maintaining a proper nutritional level for the patient. So they are supposed to provide them with proper nutrition. They are also asked to provide guidance and psychosocial support, care to the individuals, love, all these things. They might also require help with uh, their daily chores like bathing, dressing, cooking, shopping. So all these services may be provided by the home care personnel. So it can be any family member of the patient. After that, we come to the hospital care. Now, hospital care are it's usually related with the diagnosis. So they will provide laboratory facilities where the investigations can be carried out on patients, any kind of treatment of opportunistic infections, okay, other HIV related infections, sexually transmitted diseases, all these can be definitely treated in the hospitals. Acute nursing care can be given in case of hospitals. So if the individual require a surgery, if that individual requires acute nursing care, counseling and preventive educations, all these things are given by the hospitals. After this, we come to what is known as the hospice care. Now, hospice care, as I already suggested, that hospice are basically institutions which are run by some not for profit organizations or even certain religious organizations which take care of the terminally ill patients. Okay, so those patients which are terminally ill, which either they do not have a family or the family is not willing to look after the patient, or maybe the patient is reluctant to stay with the family for whatever reasons, where they are not able to provide proper care to the patient. In such cases, generally these patients are transferred to hospice, where they are given, nursing. They are given terminal care. They are provided with psychosocial support. They are, help in maintaining the hygiene and nutrition level, and also given every kind of a spiritual support. Okay, so these hospices are definitely for this. Now, when we come to various staff who is there, so there are a number of staff that are associated with these services. For example, when we talk about the daycare centers or the dispensary staff, then they would require that they would involve the PHC staff, that is the primary healthcare staff. It would involve social workers who are involved. Okay, it may involve counselors and physiotherapists and sometimes even volunteers. Okay, now this is generally the staff which we find in the what, in the daycare centers or the dispensaries. Then the family or the family support, the care or the family care, it includes people like the family, friends, neighbors. It may also be social workers. It may be, like certain non-governmental organizations or other community. It could even be doctors, nurses, healthcare workers, nutritionists, which may provide their services at the, you can say, at the house of the patients. So it depends from case to case, but usually apart from your own family, there can always be other nurses or other staff, even sometimes doctors, social workers, or other healthcare givers who are ready to stay and provide healthcare facilities to the patients in their respective homes. Okay, after that comes the hospital staff, who generally consist of the healthcare workers, consist of volunteers, medical practitioners like doctors, nurses, counselors, social workers, physiotherapists, and nutritionists. Okay, so these are some of the staff which are involved in hospitals. And finally, for hospice, we have NGOs, we have various community based organizations, we have volunteers, family of the patients, friends, doctors, social workers, and spiritual leaders who may form the part of the hospice. Okay, so we have so many individuals who form a part of this community. Now, out of all these, home care is perhaps one of the most important and you can say that crucial aspect in the management of HIV/AIDS. Now, generally, what happens that healthcare givers, uh, it healthcare refers to any form of care given to sick people in their own homes. Okay, now this may involve the things that people might do to take care of themselves or the caregiver to them by the family or healthcare workers at home. Now, this care may include physical care as well as the psychosocial care of individuals, okay, including helping them with their day to day chores. Now, caregivers generally involve the family, okay, that is the family where the person live with their immediate relatives who have the main responsibility for taking care of the sick person. Okay, now they may be a blood relative, that is, those who are related to each other through blood, like siblings, like parents, or it can be a relative by marriage. So the people can be related to each other through marriage. For example, the partners, married partners or spouses. Now, what are the reasons for the home-based care? Why home-based care is so much, preferred over other forms of care? Generally, we say that most patients they prefer to spend the terminal phase of their illness at home. They generally want to be close to their families, their loved ones, and a home is where they feel most comfortable staying. So most people's for most person individuals, they prefer spending their terminal phase of their illness at home. Second, sick people they are more comfortable in their own home and communities. Okay, now why? Of course, because they're having their families and their friends around, right? Now, home care it can reduce the burden on hospitals, because we know that generally the hospitals are usually limited in numbers, and most of the times we find that the hospitals are overburdened with other kind of cases. Okay, there may be cases related to other sicknesses, there may be cases related to accidents, or some other scenario. So obviously, most of the times we find that generally the hospitals are not available very easily. They are not available in many communities, in many places. Hospitals are not there. In such situation, home care definitely it becomes a very preferable one. Then there is a traditional support system to provide care. Okay, like the family, spouse, friends. These are the traditional support system. So every individual looks forward to being treated in their homes and being taken care of by their family. Okay, the healthcare workers they can definitely support the family. They can support the health giver, the primary health giver, or the caretaker. They can also provide, teaching or various other do's and don'ts which are related to HIV. Uh, but in a way, we say that usually home based care is preferred over all the other forms of care. Now, we see that all the symptoms that are related to HIV/AIDS, okay, the symptoms which are related to HIV/AIDS, they can be very much taken care of at home. Okay, for example, fever. that is the body temperature when it gets raised. Generally it may indicate that it's not a disease in itself, but it's a sign that tells that something is wrong in the body. So in that case, high fever, it may be taken, and it may be checked at home. It then whatever symptoms the patient is showing, uh, they can be easily consulted by the healthcare provider. So, of course, the symptoms that the HIV positive person is showing, which is related to fever and chills and other such things, they can be easily, uh, you know, um uh, used to it can be used as a symptom, and it can be again consulted by the doctor. So it is mandatory to keep a thermometer at home, and in order to check the person's temperature from time to time. if the if the temperature rises to above to a certain temperature, then what can be done is that they can be given a cold they can be given what we do is basically we keep something cold over the on the forehead, or some other extremities. So these can be such things can be definitely done. And a lot of fluids need to be given to such person who is suffering from fever. So this is something that can be done. Then another common symptom that can be related to is diarrhea. Diarrhea is very common with the persons who are suffering from HIV infection. So in this case, we need to understand that frequent fluids must be given to patients in that case. Okay. Then the care, in case if the person is feeling a lot of weakness and other things, and they must be definitely referred to the hospitals or to some healthcare provider. And lot of cleanliness needs to be kept. So that person needs to drink lot of fluids than usual, and need to continue to eat proper nutritious diet. Okay, normal diet but simple diet. So proper medicines need to be given. So all these things, they can be must kept in mind when we are dealing with the patients. Apart from that, there can be quite many other things, like there can be skin problems, and there can be problems related to the mouth and throat. There can be so many other diseases that the AIDS a person with HIV AIDS can contract. So in this case, what we need to do is we need to see every thing from a case to case perspective. We need to see what all the problems the person is going through. How can we um, take care of the person in such cases, what we can do at home, what are the best thing that can be provided at home, what are the what are how can we contact the healthcare providers, how they can help us in taking care of these symptoms. So all these things, they can be it can be very much taken care of at home. And the primary caregiver of the patient, whoever is taking care of the patient, it becomes his or her responsibility to keep check on the various symptoms that the person is showing from time to time. Okay. In case if a person has some some symptom which are beyond certain symptoms, if the person shows some certain sign or symptoms from which we understand that the maybe the condition has started worsening, in that case we need to refer the person to the hospital. So there are certain things, like for example, if there is an onset of fever or change in the regular fever patterns of the person, if there's a case of blood in the sputum, if there is a certain rapid worsening in ability to breathe or catch their breath after normal activity, okay, and there is things like, severe pain in the chest, all these things, any kind of a respiratory problem, or all these things, they must be definitely looked. And in such cases, the person need to be referred to the hospital at once. Okay, any questions till now? Any questions?
I think you should proceed.
Okay, thank you. Now, after the home care, we come to what is known as a hospital care. Usually, HIV infection, we know it's a chronic illness where the progressing, it takes several years, and the rate of that progression is different for different individuals. Now, experience has shown that progression of HIV infection, it may be slowed down or retarded with appropriate follow up or care, and using treatment of opportunistic infections with proper nutrition, with proper changes in behavior. So all these things can definitely increase the lifespan of an individual considerably and decrease the progression of that disease. Okay. Now, an interdisciplinary approach which allows for effective communication and shared decision making within the team, that needs to be there, and care providers from various disciplines and need to join forces with one another and treat the person as a whole. Okay, so for example, we are having the family of the patient, we are having the doctors, the nurses, the paramedical staff, we are also having the counselors. They are all required to join hands and provide effective care to the patient. Now, another model of ensuring care along with the continuum model is through the what is known as a multidisciplinary care model. What we have seen is, in a multidisciplinary care system, care providers from various disciplines, they provide care and treatment specific to their clinical expertise. Okay, like for example, we know that there could be a person who specialized in something. So there could be a doctor who is specialized in skin infection, there could be a doctor who's specialized in heart ailments, there could be a person who specializes in giving us psychosocial counseling. So all these specialized care and treatment must be given to the patients according to the particular condition. Okay. So an interdisciplinary care team, it may include, say, physicians, it may include nurses or attendants at home. It may also include care coordinators, a community physician. There could be specialists in pediatrics or gynecologists, social workers. There could be counselors. There could be pharmacists, physiotherapists, or volunteers, or administrative persons. Even spiritual leaders. There can be nutritionists. There can be food service providers. All these things, all these individual providers, service providers, they can join hands to provide services to the HIV/AIDS patient. Now, uh, generally what happens that there may be a time when the family is not able to attend to the requirement of the patients at home. Maybe that there is no individual at home who can take care of the person, of the patient, or sometimes a person's conditions may become so severe that they are unable to manage at home. Okay, maybe they need some specific treatment, maybe they need certain medications which can be only provided at hospitals. So in that case, we need to shift the person from the patient from the home to hospital care. Okay. Now, it is important to understand that drugs alone they cannot help improve anyone's conditions. Okay, so if you are looking at improving the health of that individual only through what we call as drugs, or you giving medicines, it is definitely not going to do any good. We need to use other mechanisms also. Okay, we need to look at the other aspects of illness also, as well as the treatments. Okay, and not only that, but also other physical aspects like the legal issues related to it, the sexual issues, financial implications, social implications, all of this which is connected to the patient. Now, sometimes we after this we will talk about some of the opportunistic infections or the secondary infections that generally develop, with patients suffering from HIV/AIDS. Now, there are some common infections which are generally easily attack the reduced immune system of the patients who are suffering from HIV/AIDS. And some common ones include tuberculosis. Now, you all know what tuberculosis is?
Yes, ma'am.
Okay. So these are basically all secondary infections, okay, like pneumonia, tuberculosis, sexually transmitted diseases, all kinds of, skin infections, eye infections, herpes, all these things. They can definitely infect a person suffering from HIV/AIDS. Apart from this, certain kinds of tumors and cancers may also are related with AIDS patients. For example, the Kaposi sarcoma. This is kind for lymphomas, which is seen, and it can infect the brain, or it can, affect some other part of the body. Especially cancer of the cervix in women is very common. Okay, so so individuals who are suffering from HIV/AIDS, they can suffer from various types of cancers. There can be certain neurological complications also. Okay, like there can be the toxic effect of various drugs and treatments, which is given to the patients. They can affect the nervous system, so they may have things like meningitis, they may suffer from dementias, they may suffer from various forms of neuropathy or myopathy. So all these neurological complications are also seen. Then another problem related with AIDS patient is a wasting syndrome. That is involuntary weight loss, or wasting is one of the common manifestation of HIV infection. Now this can occur at any stage, but is usually more severe in the later stages of illness, where the person start to lose a huge, a lot of weight, including the muscle mass. So for this, it is important that we need to improve the muscle mass of the patient. They must be made to exercise properly. They must be given proper trainings. They must be given proper nutrition. Okay, in order to regain their strength. So all these things are very much important in providing any kind of a wasting in the AIDS patient. Then there are certain age related problems which we see in women. Like we have seen that many types of vaginal fungal infections, they can be there. Pelvic inflammations, they can be there. Also cervical cancer, that can be there. So there can be certain gynecological conditions which impact women suffering from HIV/AIDS. Okay. Now, in case of patients who are suffering from advanced stage of HIV, hospital stay becomes very important, because first of all, they can go for a lot of diagnostic and other treatments, which is generally not possible at home. They are constantly under the supervision of a trained medical staff. Okay, so whenever their condition deteriorates or if they require certain treatment which we cannot give at home, hospitals provide very important places to stay. Okay, so extensive treatment and any kind of invasive treatment, if at all required, this can be given only in the hospital. So that is why hospital care is very important to HIV patients. Okay, now we have also come to this hospice care. Like we already said that basically hospice, it comes from the Latin word hospice. It means hospitality, hostel. It's related to that. So it is basically related with the idea of caring for people with kindness and generosity. Now, generally, hospice is not a new concept. It's a very old concept, and earlier we used to have place of sanctuary for religious pilgrims or travelers or poor people, the sick and the dying. And originally, a hospice and a hospital were in the same place, but now it has changed. Nowadays you see that hospitals, they work from a very different perspective. Most of them are private hospitals with the aim of making profit. Okay, but hospice are generally places which do not aim to make any profit. Okay, hospices are places where the patients are generally treated with kindness and with a lot of generosity. It is where the people or the workers who volunteer for their services, they are devoted and to care for the dying. So basically there is a lot of philanthropy which is involved in a hospice. And we find in many places, generally religious organizations, they run such hospice for persons who are terminally ill, or persons who do not have a family to take care of, or maybe the family is not willing to take care of the patient, or maybe the family cannot take care of the patient. And even for patients who are not able to provide financially for the hospital treatment or other such medical care. So this hospices, they become kind of a home away from home, where the person, they come in to receive active medical treatment with the help of other in patients and families. Okay, and it is also a place where a lot of recreational activities are done. Kind of relaxation therapies are there, meditations are there, acupuncture, all these things, they can be given to patients, so that not only their physical well-being but also their psychosocial well-being can be enhanced. Okay, so it kind of serves as a therapeutic center for the persons. Okay, uh, after this, we will talk about societal influences on HIV/AIDS transmission and prevention. So, how does the society influences the sexual behavior patterns? Okay, what impact it can have on the socioeconomic situation, how it what impact HIV can have on the socioeconomic situation of a country. Okay, all these things, they can be uh, read over here. So generally what happens, that every individual, whether it's a child, youth or adult, they apparently adopt certain behavior. Okay, at his or her own free will. They are usually under social influences of the family, or they could be under the social influence of the community and the larger society of which they have been part of from and this the HIV transmitting activities. Okay, uh, uh, are such that there is some degree of risky behavior in all societies. We find that there is always some risk behaviors which are seen by individuals in every society, whether that individual belongs to a traditional society or whether that individual belongs to a very modern society, you will always find that there will be some or the other such behaviors that an individual may show, which may increase his or her chances of contracting HIV. Okay. Now, how society influences the sexual behavior patterns. Now, if we talk about, see, this will depend, it will depend from society to society and with context to context. We say that there are a lot of societies where there is a very strict practices, where there are very strict practices related to the sexual activities between individuals. For example, there are societies which are strictly homogamous. Okay, that is that the individuals, they cannot go for more than one partner. And there can be societies which are pretty open to following heterogamous practices. Okay, where individuals are free to have multiple partners, they are free to have sex with more than one individuals. So in that case, we see that a lot of sexual behavior pattern, it depends upon the society, the kind of society in which we are living. uh, Now there is also, you see that it is not that the societies where there which are strictly homogamous, or where which are strictly you can say that um, uh, traditional societies, you do not find people diverting from the norms. You will always find people who engage in multiple partners, okay, irrespective of whatever the sexual behavior that is mandated by the community. So you will always find that these things are happening. And in the current times, when we say that the children are exposed to lot of mass communication methods, like, they have access to internet, they have easy access to or to information. They are also living with the, or maybe studying with their friends who are having access to this information. So we find that the average age of sexual activities has declined considerably in most countries. Okay. For example, one study in India, it came to that at least 5% of university students, they had premarital sexual intercourse with either a friend or a relative, and the average age of starting this was 17 years. There are certain situations, there are certain societies where this age is as low as 15. Okay, there are quite many societies, there are quite many societies where this age can be lower than this. Also, we see that many of times the uh, children or the adolescents, they practice multiple partners intercourse. Okay, they may have sexual intercourse with multiple partners or regular partners. Okay, and this makes them very, very, very prone to the HIV infections. Okay, it makes them prone to very to HIV infections. Also, we find that there are other patterns of society which are equally responsible for this. For example, the economic systems and the reproduction. Now, generally, what happened in human societies, as they have evolved, reproduction has been linked to property rights, occupation, okay, to the basically to the economic system. So institutions of family and community, it developed within socially determined structures, and these institutions, they were necessary to uh, circumscribe childbearing, childcare, and human power provided by the new generation. And so a different production system developed, like the different social structures. Now, what happened is, over a period of time, uh, reproduction got linked to a number of economic activities. Okay, it got linked to the property rights of individuals. It got linked to the occupation. So if a family is following a particular occupation, the children are more often than not, they are actually directed to follow that particular occupation. Okay, and they over a period of time, a kind of social status, a fixed social status, it started to be determined with this structure. Now, when the society evolved and became more stable, the economic systems also changed. So earlier we had the hunter gatherers, the society which were living by hunting and gathering food, and of course, wandering from one place to another. So they shared the uh, production and they shared the child wealth. Okay, and community was a central in this kind particular social structure. So we find that these societies, they kind of had a community rearing of children. Okay, where all the women who were engaged were engaged in the child rearing practices. But when the society became more stable, the economic system there, it changed. So a more stable agriculture and artisan and trading based economic systems, it came up. Okay, and along with the entire system of property, a joint family system, they were also introduced. You know anything about joint family system? What is a joint family system? Anybody?
Come again, ma'am.
Or what is a joint family system? You know anything about a joint family system? Okay, a joint family is basically a kind of family in which more than two generations, they live together, and they in under the common roof. Like in several traditional societies, even in India, and I'm sure in many parts of Africa, there must be families where the parents are living with their parents and their children. Okay, so you have more than two generations, they are residing together. They have a common economic pool, they have a common, I mean, they have a common kitchen, and they live together under the same roof. So this is actually what is known as a joint family. And even today, you find that this system is prevalent in many societies, in many communities. Now, apart from the social economic influences, somebody wants to say, Chipiliro?
Yes, before you proceed. So can we say joint family is the same as the extended family?
Pardon? Can
You
we say
said
that?
joint family.
Yeah,
Yes, you
joint
say
family.
joint. Yes, can we
Yeah.
say joint family and extended family are the same?
No, no, joint families and extended families are not exactly same. There are some differences. Okay, generally extended families also shelter a kin who generally is not a part of your otherwise joint family. Okay, for example, you may have an aunt who got widowed or who got divorced. Okay, otherwise she would have stayed in her own home. Okay, in her own family, in her husband's family. So she comes back and starts staying with you. That's kind of a extended family. Okay, joint family would imply having individuals from the same family pool. Okay, more than one. For example, grandparents living with their children and their children living with their children. Okay, so you have three, four generations living together. And extended families, in extended families, you will generally have a member uh, added to your family who would generally not be staying a part of your family. Okay, so that is what an extended family is all about. Now, apart from the family system, there are other aspects also which kind of influence the sexual activities. For example, the cultural practices and the religious influences. So, basically, what culture we are following, the kind of religious influence, the values or the ethics and the norms that are adopted by, you know, by the culture and the religion. So these are all which are very much related to the kind of social behavior or the other sexual behavior that we may see. uh, Now we know that there is process which is known as socialization. Socialization means how we transmit various aspects of culture from one generation to another. So all the practices, the norms and other knowledge systems that is handed down from one generation to another through this process of socialization. And there are several socializing agencies which are responsible for socialization. For example, the first and foremost is the family. Then we have the schools and other educational institutions. We have the peer group. Okay, we have the extended families. We have things like mass media. Okay, then these are some of the agencies that influence the socialization of an individual to a great extent. Now, apart from this, there are also certain other things that have impacted the way our social behavior or our understanding of things have changed. For example, how there has been a shift with respect to things like liberalization and globalization, how opening up of economies, how coming in contact with other cultures that has come more and more. We have started understanding the other cultures. We are more in touch with the people from other cultures. So people have started adopting those practices. Okay, people have started adopting those concepts. For example, a simple thing like dating. Now, dating is something which is not very much seen in traditional societies. In traditional societies, you will not find the concept of dating, because they generally practice the concept of what is known as an arranged marriage. So dating is generally when individuals, they are going together, they are interested, they are romantically or otherwise sexually interested in one another. They start seeing another one another, and that is they start dating. So the concept of dating is definitely not seen in very traditional societies. But nowadays we see that even in the otherwise traditional societies, the norms have shifted, and now we find more of what we say, marriage by choice happening, and this concept of dating which has become very common. This has also increased awareness about sexual encounters, about sexual activities. you know uh, st- uh, we say that the societies, they have become more open, more accepting towards premarital sexual relationships. But again, another thing is that apart from the fact that they have given lot of individual freedom, along with that they have also brought about this entire menace of HIV AIDS and this epidemics. So it is not that to say that this is anyways bad, or there is any bad practice related to it, and or that premarital sex must not be done, or it is not good to go for multiple partners. There is no hard and fast rules about it. Okay, it is again an individual choice. But again, the important thing is to understand that apart from individual freedom, there is something which is known as responsibility towards your family, responsibility towards your partner, responsibility towards the community as a whole. And we need to understand and go for a more informed decision making. We need to understand the pros and cons which may be related to multi-partner sexual activities. We may understand how we can go for more safer sexual practices. Okay, how we can follow certain practices or certain precautions or preventive measures that prevent us from contracting the disease, and also prevent our family members, our partners from contracting these diseases. Okay, now, in the next session, we will take this discussion further, and we will see how the medical system is playing the role in promoting, preventive measures and preventing HIV transmission, and also vice versa. We will also be seeing other practices that are there at present. And tomorrow we will meet at the same time. And I expect that all of you would be reading your first and the second block. In case if there is any problem relating to the first two blocks, then we can discuss the same during the second half of the session. Okay, so I may keep around 15 minutes separately for any kind of question answer session where you can ask your problems, and we can have a more interactive session then. Okay, so we will meet again tomorrow. Thank you so much once again for your time and for your patience, and I will be seeing you again tomorrow. Till then, have a fantastic day. Okay, and stay healthy, stay well. See you again tomorrow.
Thank you, ma. Thank
Thank
you.
you.
Thank you,
Thank
everybody.
you,
Thank you.
madam.
Thank you for joining.
Thank
Thank you
you.
so
Thank
much.
you, ma'am. Thank you.
Thank you so much. Okay.